to the Secretary of State in support of an urgently needed £50 million refurbishment plan for Sheffield's Western Park Cancer Centre. Can I urge the Secretary of State to give serious consideration to the proposal, which would ensure patients across South Yorkshire and Bassetlaw receive the best possible treatment?
Secretary of State.
Yes, thank you very much, Madam Deputy Speaker. And I have seen the letter and I'm looking into what we can do. The need to tackle cancer is both more urgent because of the crisis, but also has more hope. And the hope is that the same underlying technology behind some of the vaccines, the so-called mRNA technology, also has the potential to improve radically cancer-fighting technology. And so we propose and plan to support very significantly work in order to find further breakthroughs in cancer treatment. And I'd be very happy to talk to him and indeed you about the proposal for South Yorkshire.
We now have video link to Duncan Baker.
Thank you, Madam Deputy Speaker. Given the sterling success of the vaccination rollout in North Norfolk, where on recent numbers we had vaccinated the second highest number of people by constituency population in the whole country, can my right honourable friend assure my constituents that despite the recent supply news, the vast majority of them will see no interruption to them being given their first and second doses in the rollout programme?
Yes.
Video link to Barry Shearman.
Madam Deputy Speaker, the Secretary of State knows that I sometimes criticise him, but I sometimes pat him on the back. And I want to pat him on the back in terms of much of what he's done. And yesterday's evidence from a select committee just shows he didn't always get the support he needed from Number 10 and from Dominic Cummings in particular. But can I tell him that what I want to see is a level playing field, whether it's Harlow or Richmond or Huddersfield. There is some resistance to getting the vaccine in some of our urban centres. And can I assure him that I will work with him and we all will work cross-bench to make sure that people know it's so vital to get the vaccine wherever they live. And I hope we can have a good PR effort working together to do that.
Thank you. Secretary of State.
Madam Deputy Speaker, I'm a pretty collegiate kind of guy, and I generally see the best in people, and I see the best in the honourable gentleman. One of the things that I've really enjoyed about this vaccine rollout is that it has been a totally cross-party effort, and people have really lent in to getting the message out. I look forward to working with my honourable friend on certainly today in what he suggests.
A video link to Dr. Luke Evans.
Thank you, Madam Deputy Speaker. And the Health Secretary will know from coming to the Health Select Committee how we're concerned about dealing with the backlog. So it's great for him to be taking such a proactive stance to deal with that backlog. He set out in his speech just how big that backlog is going to be for the elective surgeries. So can he ask, because the question coming from Bosworth would be, how long does he think it will take as an estimate to clear all the backlog that's built up on the elective surgeries?
I'm working with the NHS to answer that question right now. It's a characteristically acute question from my honourable friend, we aren't able yet to answer it simply because the pace at which we can return activity to full normal levels is not yet clear, because the main barrier to that recovery is a combination of infection prevention and control and the need for staff to get some R&R. We'll know more in the coming weeks and months.
Video link to Tim Farron.
Thank you. There is not a mention in the Secretary of State's statement of cancer, nor a single penny in the budget to boost cancer services, despite Macmillan Cancer's figures that show a need to increase all cancer services by 10% for a full solid 15 months starting now to clear the cancer backlog. Macmillan also say that there are 37,000 people with cancer who are not yet even in the system. Given this crisis and the scale of it, will he agree to an urgent, ambitious and funded plan to catch up with cancer so that tens of thousands of people do not unnecessarily lose their lives?
Secretary of State.
The need to catch up on the backlog is across all elective operations, and of course that includes cancer. The good news is that the NHS worked incredibly hard, especially in this second peak, to make sure that cancer services remained working and effective as much as is possible. And some cancer services, in fact, delivered more than their normal pre-pandemic levels of care. So absolutely, he's right that we've got to make sure that any backlog is reduced. That is a critical part of what I've been talking about today.
Video link to Pauline Latham.
Thank you, Madam Deputy Speaker. The vaccine rollout has been incredibly successful. We have just come against a bit of a hiccup now with the AstraZeneca vaccine. Now, Europe don't seem to be too keen on using this. Could we not use their vaccine? And could my right honourable friend assure me that the Pfizer vaccine will be available not just for second jabs, but for first jabs during the month of April, please?
Well, my honourable friend has put her finger on a certain irony in two different positions that our European friends are taking at the same time. I think the best thing to say is that I hope that following the MHRA's statement later today and on consideration by the EMA, then we can get this vaccine going everywhere because the data are really very clear that it saves lives. That's what the European Medicines Agency themselves have said throughout the last couple of weeks, and I think it's important to follow the science in this one.
Video link to Charlotte Nichols.
Thank you, Madam Deputy Speaker. I'd like to thank all of those in Warrington involved in the vaccine rollout, including our NHS and community vaccine centres, GPs and primary care networks, pharmacists and volunteers. While I patiently await my own jab as a 29-year-old, I've been so heartened by the progress made so far in getting our community vaccinated. Can the Secretary of State please therefore reassure the House that if high-risk people in the top categories come forward for their first dose of the vaccine, that they won't be prevented from receiving this as a result of anticipated delays to delivery?
That is absolutely our goal, and she's 29, I'm 42. The fact is that you have to vaccinate an awful lot of people of our age to save the same amount of lives as vaccinating just one octogenarian. So we're going to take this time to loop back and to find as many people in the most vulnerable cohorts as possible. That is the way to save as many lives as possible and to reduce pressure on hospitals as much as is possible. So I hope that she'll bear with in the same way I'm having to bear with until we are able then to open up vaccinations for firstly for those in their 40s, then 30s, then finally the youngsters.
Philip Hollowbone.
Kettering-born Professor Sarah Gilbert of Oxford University, who's led the team that developed the Oxford AstraZeneca vaccine, attended Kettering High School for Girls, which is now Southfield School, in the 1970s. And it was at that school that she first decided she wanted to work in medical research. As a heroine of the town, Sarah's name is today being added in a mayoral ceremony to Kettering's historic timeline in the marketplace, which commemorates key milestones, achievements and famous local people. Will the Secretary of State join me in congratulating Sarah on this thoroughly well-deserved accolade from her hometown, praising her outstanding work and recognising her as a role model for young people everywhere who want to enter a worthwhile career in science?
Well, I'm sure that the whole House, Madam Deputy Speaker, will agree with every single word of what my honourable friend has just said. They say success has many fathers, and Kettering has discovered another extraordinary daughter in this vaccine rollout. Sarah Gilbert worked on the Ebola vaccine before this one, and has played a role in saving many, many, many thousands of lives over her career in medical research, and I have no doubt many, many, many more in the future. And we all salute her work, and we salute her attitude and her teamwork too, because that is one of the characteristics that has made it so possible to be able to deliver these vaccines so fast.
Indeed. We now go to Dr. Lisa Cameron.
Many thanks, Madam Deputy Speaker. As chair of the Disability All-Party Parliamentary Group, we have been hearing absolutely heartbreaking accounts that the pandemic has had a disproportionate effect on disabled people across the United Kingdom. According to a survey conducted by the Family Fund, 93% of families said coronavirus had negatively affected disabled or seriously ill children's mental health. So what crucial steps are government taking to support the mental health and well-being of children and adults with disabilities?
She's quite right to raise this, Madam Deputy Speaker. It's an incredibly important subject. Of course, those with disabilities have been recognised in where they have clinical priority for a vaccine, as have their carers, according to clinical advice. And part of the £500 million of mental health funding that I mentioned in my statement will, of course, go towards strengthening further children's mental health services, with the goal that mental and physical health are treated with parity, which, of course, they should be.
Villiers.
The United Kingdom's vaccination programme has been amongst the most successful in the world, right from the point at which the government took the decision to fund the scientists that made it all possible. With these constraints on supply, is he still confident that we can follow our roadmap to release, which is so important to so many families and so many businesses across the country?
Yes, we did fund the science from the start, and we work collegiately to make that happen. And I can confirm that there is no impact on the roadmap timetable from the news on supply, because we remain on track in terms of the targets that we've set out.
Video link, Mary Kelly-Foy.
Thank you, Madam Deputy Speaker. If there are indeed issues with the vaccine supply, it doesn't make sense that countless manufacturers across the world are unable to produce COVID-19 vaccines, treatments, diagnostics and other health technologies because of intellectual property restrictions and pharmaceutical monopolies that prevent open technology sharing. Will the government now commit to supporting a waiver of COVID-19 related patents at the World Trade Organization, or is artificially limiting vaccine supply official government policy?
Madam Deputy Speaker, I'm very happy to provide the Honourable Lady with a briefing because she should be very, very proud of her country, because AstraZeneca are providing the Oxford vaccine free of charge, not charging for any intellectual property rights, right around the world. That isn't true, as she implies, of all of the vaccine companies, but she should be really, really proud of ours.
Video link to Simon Fell.
Thank you, Madam Deputy Speaker. I was listening to the excellent COVID Confidential podcast on the BBC and was surprised and delighted to find out that the various vaccines, when they're in production, were named after submarines that were built in my constituency. So can I firstly thank my right honourable friend on his choice of names, but secondly, not to labour this analogy, a good defence rests on having a good range of options. Kate Bingham recently said that not having monoclonal antibodies as part of our defence is the gap in our armour. Could my right honourable friend possibly give an update on where his department is on this?
Yes, this is an incredibly important subject, and we're working very hard on it with clinical leads and external experts. I said earlier, Madam Deputy Speaker, that success has many fathers, and I'm sure that people of Barrow are very proud of their role in making sure that we could keep what needed to be kept confidential. We've now had to change all those names because everybody knows about it.
Video link, Tulip Siddiq.
Thank you. GP surgeries have been critical to the rollout of the vaccine, and I pay tribute to all those involved. However, many of my constituents are concerned that the Centene Corporation, a massive American health insurance firm, has just taken over dozens of GP surgeries in London, including Bromsbury and Swiss Cottage GP hubs in Hampstead and Kilburn and others in Camden. Does the Secretary of State share their concerns that this appears to have taken place with no meaningful public scrutiny and about the increasing involvement of US healthcare corporations in our health system?
No.
Video link to Andrew Selou.
Given the link between COVID deaths and obesity, does the Secretary of State share my concern that children from the poorest constituencies are being the most heavily targeted by social media junk food adverts, and that over half of the top UK child influencers on Instagram have promoted junk food in the last year? So will he meet some of the young people from Bite Back 2030 who are concerned about this?
I'd be very happy to ensure that the children from Bite Back 2030 meet with the Minister for Public Health, who leads on these matters. It's an incredibly important point that my honourable friend rightly raises.
Liz Twist.
Thank you, Madam Deputy Speaker. Almost as soon as the Secretary of State sat down yesterday after his statement, I was contacted by a constituent who is shielding and is very concerned that now, having been told that shielding will end on the 31st of March, but hasn't had his second jab. Will the Secretary of State be issuing guidelines on what those people should do, as my constituent is asking?
Yes, absolutely, and we'll be writing to all those who are shielding to set out the details so that they get a personal copy of those guidelines. What I would say is that the rates of COVID now are much lower than when we've had shielding paused in the past. And so it's not just the vaccination programme, which of course has benefited many, many people who are shielding. And we know that the first dose brings huge safety and benefit already. But it's also because the rates of COVID are so much lower.
Video link to Aaron Bell.
Thank you, Madam Deputy Speaker. On behalf of their citizens who need to be vaccinated, who need to see their economies reopen, I have to say I am personally in despair at the short-sighted decisions that have been taken by many European countries and what seems to be their absurd misapplication of the precautionary principle. I'm sure my right honourable friend would wish to be diplomatic, so will he join me in praising what we are doing, both the MHRA and the JCVI, for their sensible and proportionate decision-making, which has always prioritised public health here in the UK, both in respect of the approvals given for vaccines and the dosing regimens they've subsequently recommended?
Yes, my honourable friend puts it characteristically well. It is very important to take all considerations into account when making decisions like these. Of course, the precautionary principle is an important one, but over precaution, when there are such huge benefits to vaccination, is itself a mistake. What you have to do is take the overall public health into account.
Video link, Rebecca Long-Bailey.
Thank you, Madam Deputy Speaker. The Salford system has delivered the COVID vaccine in an unprecedented way. Everyone from cohorts 1 to 9 have been invited at least once, some 3 or 4 times. And I understand that even with the vaccine shortage and guaranteed second doses factored in, we will run out of people in cohorts 1 to 9 to give our current vaccine supply to. So will the Secretary authorise today that Salford may proceed to cohorts 10, 11 and 12 and begin prioritising the vulnerable members of these age groups so that we can maximise the doses we have?
No. What everybody needs to do in Salford, as around the country, is make sure that every last effort is made to reach every last person in groups 1 to 9, because these are the most vulnerable. Only in exceptional circumstances should people under the age of 50 who are not in groups 1 to 9 be invited to vaccination. The message is incredibly clear. Please, the whole team, including in Salford, I'll speak to you very directly. Please put all of your efforts in the forthcoming weeks into delivering vaccines for groups 1 to 9.
The final question is to Jason McCartney.
Thank you, Madam Deputy Speaker. As I'm over 50, I'm getting my Oxford AstraZeneca jab later today at my local Honley Village vaccination centre, where they've now delivered over 10,000 vaccinations. Will the Health Secretary please join me in thanking our wonderful local NHS, the pharmacy involved and all the volunteers there, and just confirm once again, we're still on track to vaccinate all over 50s and deliver the second doses as planned?
Yes, absolutely, and it's wonderful to see the joy on his face in anticipation of his jab. May I say, Madam Deputy Speaker, I hope that he gets the opportunity to change, maybe into a short-sleeve shirt, because we have seen some colleagues inadvertently have to undo an awful lot of buttons in order to be vaccinated. And whilst I can imagine that some of their more enthusiastic constituents may have enjoyed the sight, I think it's best if we gents wear a short-sleeve shirt so that we don't have to bare our hairy chests.
I thank the Secretary of State for his statement and will suspend the House for approximately 3 minutes to make the necessary arrangements for the next business. Order, order. We now come to the Select Committee statement. William Ragg will speak for up to 10 minutes, during which no interventions may be made or taken. At the conclusion of his statement, I will call members to put questions on the subject of the statement and will call William Ragg to respond to these in turn. And I should say these should be brief questions so that the Chair can answer them succinctly as well. I'm sure all honourable and right honourable members will be aware that there is two very well subscribed debates to come as well. So I call the Chair of the Public Administration and Constitutional Affairs Committee, William Ragg.